Every 47 minutes, a woman tests positive for HIV in the U.S. Yes, the CDC stats are eye-opening, but women and girls are fighting back with the most powerful weapons they have: education and prevention. Washington Full Circle starts right now. Welcome to Washington Full Circle. I'm Furman Patterson. The statistics are alarming. More than 226,000 women, 80% of whom are of childbearing age, 15 to 44, are HIV positive. All women and girls older than 15 should be tested at least once to find out their HIV status. Youth ages 13 to 24 accounted for an estimated 26% of all new HIV infections in the U.S. in 2010. In 2012, people 55 and older accounted for 1/4 of all Americans living with HIV in the U.S. Because of those numbers, women on the front lines believe the best defense is a good offense. In fact, that theme is part of a nationwide awareness campaign to help empower women and girls in protecting their health. With us is Martha Bond from the U.S. Department of Health and Human Services Office on Women's Health, and Megan Coleman from Whitman Walker Health. Thanks to you both for joining us on this important announcement. First of all, those statistics are alarming. The first thing I thought is there's a focus on women and girls. Why the focus on girls? Because men and women are affected.
The focus on girls, and particularly for the Office on Women's Health, is because there are increasingly numbers that indicate the impact on women and girls is greatest. There's a need for more support. There's a need for the best defense is a good offense, so that prevention is the word. We need girls and women to have a best play, to have a defense play, to understand these issues, to know that there are simple and effective ways to protect themselves from HIV.
And so this is a nationwide campaign. It's national and local. What do you find is a response for, this has been going on, this campaign, for 11 years now. What's the response to it been so far?
In the district?
Yes.
So we see a lot of people getting excited about prevention and learning about it. I think that it's catching on, and more people are talking about ways that they can take control of their own sexual health and their prevention and their protection, especially with young women, especially school-based clinics and young college-age students. We have many local colleges here, and many of them, our work is done directly with testing and counseling in colleges, testing and counseling in schools, and in youth-oriented programs. Okay,
and so over these 11 years, what kind of progress have you seen in women adapting to these tools?
We've seen great progress. We've seen communities coming together across the country. The Office on Women's Health has many partners. We also have supporters who look to share the information about getting tested, making sure that with the choices that women have when they want to consider sex, that first abstinence is the surest way to avoid HIV. And then to get tested, there's a tested site, gettested.cdc.gov, in which you put in your zip code and your city or state to look at opportunities for free testing that's confidential. And the opportunities we've had with the 2010 enactment of the Affordable Care Act has brought millions more insurance opportunities, and particularly those living with HIV, as well as the new antiretroviral therapies. So there are opportunities, and in, I would say, the District of Columbia, we will make sure that the word gets out about acknowledging the support for women and girls.
And especially here in the District of Columbia, the effect on African American women, I think those numbers are even more alarming when it comes to African Americans in D.C. Tell us about that.
They are. I think that the 2014 data that the D.C. Department of Health just released showed that I believe 93% of women living with HIV were African American. and 17% of new diagnosed cases are with women, and the majority of those are through heterosexual or sex with a male partner. So it really is an issue in the district, and something that we need to provide more education and just get the word out there.
Now you see races and runs and these type of campaigns for things like cancer, breast cancer, things like that. But for HIV/AIDS, there's always this stigma attached. What's the best method for dealing with that, to making people overcome that stigma, to talk about it in ways to counteract it?
Very simply, it's what we're doing right now, and perhaps in many social settings, and being unafraid to take on the conversation with our friends, with our family, to perhaps take a family member to get tested, to be willing to support those in our families who are HIV positive, but to start the conversation and not be afraid to have the conversation. So while it may not be as formal as what we're doing right now, certainly it gives us an opportunity to help start the discussion. And when we look at the support for women who are living alone, some are taking care of family members with HIV, some go to work every day, we should begin to start the conversation so people aren't afraid to talk about it.
I agree. And if one way to address rumors or fear is just with information and being open and honest. And it doesn't have to be complicated, and it doesn't have to be that you know the answer all the way, but just ask the question and be in a safe spot to know that however you ask the question, you'll be able to get the answer for what you need.
Excellent.
And we know HIV is not transmitted through water or air or toilet seats or
Hugging.
hugs.
Hold that thought. There's more to talk about. We've got plenty of time. We're going to take a break. More on how women and girls are fighting HIV in education with prevention. Washington Full Circle will be right back in a moment. Welcome back to Washington Full Circle. In the wars against HIV/AIDS, both national and local health organizations are encouraging women and girls to put their best defense into play: education and awareness. How easy is it to get tested for HIV here in the district?
It's very easy to get tested here in the district. We have one of our partners right here, Whitman Walker Clinic, where testing is free and confidential.
Testing is free and confidential. You can walk in and get tested. We have evening hours on Tuesday and Thursday night. There's also a variety of places throughout the district. The District Department of Health does testing. There's testing in schools. We also have mobile testing where we'll go out to different vendors or places throughout the city and do testing like we do at Chinatown, I believe at the third Thursday of the month. So just, we can always be on the lookout, and we have a Twitter handle if anybody wants to follow us.
Now, Whitman Walker has had a close relationship, a partnership with the District of Columbia. Tell us about some of the things you do together. Absolutely.
So the HIV in the district cannot be solved by one organization. It needs to be really a collaboration throughout the entire city. So we work very closely with our academic partners and also our government partners, both the federal government and the local government and the CDC, with trying to organize testing throughout the city, trying to find people and then engage them into care. Because really one of the best ways to prevent HIV is to get people who are positive into treatment and into care, because overall that will reduce the viral burden or the possibility for someone to become positive if someone's on medication. So that's one of the ways we do it. And then I do a lot of training on what's called PrEP, or pre-exposure prophylaxis, throughout the district, so that people are aware of it and as an option of taking a medication to prevent HIV, which is one of our newest breakthroughs in the last few years.
How many people know about that? Because, I mean, for years people have known that there have been treatments, cocktails for treatment of AIDS, but now we're hearing different pills that pre-exposure and post-exposure. Tell us about that.
Pre-exposure prophylaxis would give you a 90% chance,
it's,
or above
it's between
90%?
90 and 99% based on different modeling. So what it is, it's an old idea, just in a new way. We're used to taking a pill to prevent something. Women take pills to prevent pregnancy all the time. It's the oral contraception. So it's just taking a pill a day to prevent HIV. You have to take it before you come in contact with the HIV virus. Otherwise, it doesn't work. It doesn't work in that way. So when women, we say you have to take it a few weeks. We think about 3 weeks in order to build up protection, but we don't actually know.
One
pill every day, and it offers between 90 and 96 to 99% protection against HIV.
Okay, so that's for people that are HIV negative.
That's the most important part. You have to be HIV negative before starting that. So you have to get an HIV test, and you get it as part of a provider visit. So I see patients every 3 months, and we do regular screening for other STDs like gonorrhea or chlamydia, and we talk about ways that they can protect themselves against HIV. That conversation includes condoms and includes abstinence. It's really targeting a conversation for where an individual is. It's not a one-stop choice for everyone, but it's an option that people should know of.
Well, what's the option for women that have an HIV positive partner?
So this is one of the options. One of the best things, it's a combination. So the HIV positive partner getting on treatment and getting undetectable, so not being able to find the virus in their blood by our normal testing. And the studies have shown that's 96% effective at reducing the spread of HIV to the negative partner. So that works really well. And then the other thing is the negative partner can take their own protection into their own hands, which can be empowering. And that is taking the pill every day to prevent HIV. They also are some people that do it around pregnancy or conception, because you know that people are having sex without condoms because they're trying to get pregnant. And we know that many women in studies have wanted to have pregnancies with their HIV positive partner, especially in areas in Africa or other areas around the world. And so this is one other option at their disposal. And then also patients can take a medication after they've been possibly exposed to HIV. And so that's called post-exposure prophylaxis, or PEP, or PEP. And within 3 days, you take a series of medications for a month, and that reduces your risk. So there's multiple different ways we can use treatment as prevention. Either the negative partner takes a medication every day, the negative partner after an exposure takes a medication daily for a month, or the positive partner is on medication, and the best situation is probably a combination of 2 different ways.
So since the introduction of these medications over the years, how long has it been around?
So antiretroviral therapy has been around for many, many years, but the PrEP has been approved. Truvada there's only one medication approved for prevention, and that's Truvada, and that's 2013.
Okay, so nationally, with the introduction of all of these things, have we seen any difference in the statistics and the number? Has it made a dent?
I'm not sure, but I do know there needs to be a larger discussion with clinicians and with doctors to make sure that it's offered to women and girls. So when you look at Whitman Walker, which is doing a phenomenal job, I think women may tend to have another entry point in the medical services. So doctors and nurses need to know more about PrEP and PEP.
Absolutely, especially women go to the doctor routinely once a year for regular GYN checkups or sexual health checkups, and that's a great opportunity to talk about ways they can protect themselves.
Right. Okay. Well, there's more to talk about. Stay put. Don't go away. You will be right back with more on HIV/AIDS awareness and women and girls and how they're fighting back when Washington Full Circle returns. Welcome back to Washington Full Circle, as today's guests help shed light on the impact of HIV and AIDS on women and girls and their campaign of prevention. Now, seeing your red reminds me of Rock the Red Pump campaign. Tell us what that's all about.
Walk the Red Pump campaign is another awareness strategy for women to support the issue of increasing rates of HIV in women and girls, a prevention strategy. I unfortunately didn't wear my red pumps, but I have my red. And I believe in the early 90s, it was a color that was chosen to acknowledge persons living with HIV and also the awareness, to build the awareness. The Red Pump is an organization that started out in Chicago. They are a partner of the Office on Women's Health and certainly support our work. Our website, womenshealth.gov /National Women and Girls HIV/AIDS Awareness Day, NWGHAAD, will provide more information. This is another very important strategy for African American women, women of color around the country to take a more active involvement. And red being the dominant color, red pumps, and everybody likes stepping out and being able to be aware of the importance. So it was another organizational strategy to look at building the bridge of information. Women need information, women need to have informed choices, and women and girls, I think, in the District of Columbia, across the nation, are so important in this issue.
And locally, Whitman Walker has a lot of its own campaigns that they do throughout the year. What are some of the most important for you?
We do. We're actually going to be partnering and at the National Women and Girls HIV Awareness Day, and then we have multiple times when we speak with different youth organizations. And then speaking of a walk, there is the Walk to End HIV that we work with in October. And that's a wonderful event. It draws in so many people, and it's always been great. And then we have a variety of ways that they can contribute and give back, and it's all on our website if anybody wants to come visit it.
Now, one of the things we haven't talked about yet is, and it's one of the tools too, is you tell women and girls to fight back, it's abstinence. And that's usually a tough one. It's always pushback about that, but what's the strategy for getting that message across how important abstinence is in preventing HIV?
On a personal level,
Yeah.
I believe it starts with the family. I believe we are in a position to be able to talk to our children about abstinence first, to give young women and girls a choice, to be able to support their decision about sex, and to ensure that we're comfortable with the decisions that they make, and we support them. We have programs across the city in schools that certainly talk about abstinence, but on a personal level, and I'm the mother of 2 adult children, but I believe the conversation starts at home.
And how early does it start with your kids in talking about issues like
I think
sex
many of
and
the school programs start as early as 10, 11.
I don't know when they actually, I believe they start as early as that. And I think that part of the push is that women and girls can make informed choices and be active participants in their decision on when they are to have sex, if they're going to have sex, either after marriage or before, whatever works for them, but that they have the choice and the opportunity to make that choice.
Absolutely.
And I say that and talk about the age because the statistics mention young girls being tested at least once by 15. So that age is already injected into the discussion.
Well, and that testing also relates to ensuring that if they have shared needles, if there is a relationship, a sexual relationship that was with an unprotected partner, that the checkup, the testing of HIV at that point would ensure that they are not HIV positive. If they are, that they are in care and treatment. So there are certain activities that we know put women and girls at risk, and those steps, those steps to use a condom every time you have sex are very important. So the issue of testing if you believe you are at risk and have had unprotected sex is very, very critical. I'm not sure about the age, but I do know that the conversation has to start in a comfortable setting where women and girls are given an open opportunity to talk about it as openly as we are here.
Right.
Yeah.
And how has the male population been responding to this focus on their partners, the women partners, that you found out?
I feel that most of the males that I've heard about have been really supportive of this. I think we're not going to get to zero. I know in DC, the mayor has a plan for getting towards zero, and the WHO by 2020 to get more people engaged in care. And we're not going to get there without both parties kind of having conversations and having this open dialogue. And I think as we get more and more dialogue, I think we'll kind of understand more and more how we can help each other.
And we're working very closely with the national strategy on HIV/AIDS in the United States, updated to the 2020 version, which does address many partners who include men who are supportive of looking at the issue of protecting women and girls. So it is a growing opportunity for men and boys to become involved and be part of the conversation.
Terrific. And the website for your...
The website for the National Women and Girls HIV/AIDS Awareness Day walk is womenshealth.gov/National Women and Girls HIV/AIDS Awareness Day, NWGHAAD.
Thank you so much, both of you, for joining in. So much for all the information.
Thank you.
That's it for Washington Full Circle. Thanks to our guests and thanks to you for watching. We'll see you again next time.